Welcome to course unit 7, the origin of dangerous drugs. So the topics to be discussed today is all about how drugs are administered, the classification of drugs, the medical uses of drugs, the different dosage, and the pharmacological classification of drugs, which is yung naging activity nyo kanina. So, how drugs are administered? Pag sinabing administered or administration of drugs, paano ba nakakapasok yung drugs sa inyo? So, we have different ways po. Okay? We have oral, injection, inhalation, topical, iontophoresis, buccal, suppositories, or sublingual. Okay, let's start muna sa oral. Ito, okay, this is the, yung oral na to, madalas na ginagawa natin. Diba? Nowadays. So, oral administration of drugs, it is the safest and most convenient and economical route whenever possible. Diba, sa lahat naman ng drugs natin, always po, oral ang pag-intake natin sa kanila. Diba? There are, however, drugs which cannot be administered this way. Pero ma'am, bakit minsan hindi natin oral tinitaken yung mga drugs na yun? Kasi minsan, kailangan injection or kailangan, minsan naman masyadong malaki yung drug. So, kailangan mo nang ibahin ang form. So, again, oral is the most safest and most convenient way of administering drugs to our bodies. And then, the next one, injection. Ayan, diba? Also, ginagamit natin tong form na to para ma-intake yung drug. So, this form of a drug administration offer a faster response. Kapag ang sakit kailangan ng mabilisang gamot, okay? Ang gagamitin nilang way para administer yung gamot is through injection. Kasi pwede lang padaan yan through veins, diba? So, directly na magagamot yung mismong masakit sa kanya or ano man ang sakit niya. Next naman, we have the inhalation. Alam nyo na to, or inhalation, diba? Pinapadala dito, pinapadaan through air of our, in our nose or even in our mouth. So, this route makes us use of gaseous and volatile drugs, which are inhaled and absorbed rapidly through the mucus of the respiratory tract. And then next, topical. Itong topical naman to, parang lotion lang, diba? This refers to the application of drugs directly to the body sites such as the skin or the mucous membrane. Yun ang topical. Again, we have the oral, injection, inhalation, and then the topical. Next one, we have naman itong iontophoresis. Naka-try na ba na kayo ng ganito? Nakapag-take na kayo ng kanwari na kayo sa hospital, tas yung way ng pag-administer ng drugs sa inyo is iontophoresis. Na-try nyo na ba to? Meron na bang nakatry sa inyo? So, ang iontophoresis, ganito siya. Para siyang, meron siyang electronic devices na ganyan. And then, mapupunta yan sa mismo, para siyang kagat ng langgam. Na parang tinutusok yung mismong, tawag dito, laman mo. Okay? Kasi nga, introduction of drugs into deeper layers of the skin. Pero parang patches lang to. Ayan, kung nakikita nyo dito. Para lang siyang patches. Okay? Para lang siyang patches na yan. Ayan. And then, automatically, ma-absorb yung drugs doon sa mismong deeper layers of your skin. Okay po. And then, buccal. Okay. Ang buccal naman, ito yung way wherein lalagay natin yung drugs sa ilalim ng lips. Diyan. So, yung iba, diba, dyan nila nilalagay. Alam ko kapag, if I'm not sure, kapag sa mga blood pressure, mataas yung presyon. Diba, dito nila pinapalagay yung, drugs na yan. So, the drug is administered by placing the buccal cavity or just under the lips. The active ingredients of the drugs are absorbed into the bloodstream through the soft tissues lining in the mouth. So, minsan dyan nila pinapadaan or pinapalusaw. Next naman is suppositories. Okay, bago suppositories muna, ito muna sublingual. Itong sublingual naman, sa ilalim naman ng dila. So, huwag kayong magkalitohan na. Itong sa buccal, sa ilalim ng lips. Itong sa sublingual, sa ilalim po ng dila. Next naman, or the last one, is si suppositories. Ano naman po yung suppositories, ma'am? Yung suppositories, ito po yung pinapadaan sa puwet or sa rectum. Diba? It is administered through vagina or rectum in suppository form, and the drug is also absorbed into the bloodstream. Ito na siguro yung pinakamasakit na way ng pagdaan ng gamot, diba? Kasi iyan, ilalagay yan sa puwetan nyo talaga, sa mismong rectum nyo, para lang ma-administer yung drug. So, again, we have yan, oral, injection, inhalation, topical, iontophoresis, buccal, suppositories, and sublingual these are the ways on how we can administer drugs in our body. Next. So, what are the different forms of drugs? Diba? May tablets. Ano pinagkaiba ng tablet sa capsule? Ang tablet, ito yung parang nangunguya nyo. Ang capsule, yung parang mayroon siyang plastic. And then, we have syrup or liquid. Pwede yung plant or herbs. Pwede rin siyang cigarette or yung tobacco. Pwede rin in a powder form. And pwede rin po siya yung parang crystal form. So, we have 7 categories of drugs. So, yung kanina, ito, forms yan. Kung ano yung itsura niya. Ito naman, categories of drugs. So, number 1, we have herbal. So, ano yung herbal? These are plant substances that have drug effects and whose use is not generally regulated by law. Diba kapag herbs yan, usually mga ano lang yan, lagundi, pwede rin yung oregano, ayan. Usually, hindi yan regulated ng law unless it is a cannabis sativa or marijuana. So, these substances generally required little processing after the plants are gathered. Ano yung mga klase ng herbs natin dito sa Pinas? Alam mo yung pinapakuluan daw nila yung kasi yun, yung dahon ng bayabas, tapos yun yung papaligo. Herbs yun. Or,
oregano, ma'am.
Oregano. Ayan. So, yun yung mga herbs. Okay po. Then, we have over-the-counter drugs. Ano naman yung over-the-counter drugs? Pag sinabi natin over-the-counter drugs, ito yung mga nabibili natin sa pharmacy. Okay? These are commercially produced drugs that may be purchased legally without prescription. Ito yung nabibili nyo sa pharmacy kahit wala kayong reseta. Diba? Katulad ng Biogesic, paracetamol, ganyan, Vicks. Ayan. So, they are also known as proprietary drugs. Again, these are the over-the-counter drugs. Next, meron din tayong tinatawag na prescription drugs or prescriptive drugs. Ito naman, ito yung mga drugs na nabibili din po sa mga pharmacy pero kailangan ng reseta ng doktor. So, these are commercially produced drugs that can legally sold or dispensed only by a physician or a physician's order. So, they are like the over-the-counter drugs in that they are manufactured by pharmaceutical companies, but they differ in the decision to use of drugs is legally vested in a licensed physician and not in the user. Next, unrecognized. How about yung unrecognized drugs? These are commercial products that have active drug effects but are not considered drugs, okay? These are substances that are generally regulated by law except insofar as standards of sanitation and purity are required. Ano yung mga unrecognized drugs? Okay? Ito yung mga vitamins. Or, alam niyo yung, for example, ano kasi yun? Lola Remedios. You know is Lola Remedios? Ang Lola Remedios, it is a form of unrecognized drugs. Bakit? Hindi po siya talaga gamot sa isang sakit. Diba? Commercial products sila, commercial drugs sila. Pero diba, kung mapapansin nyo dun sa mga patalastas nila, okay? Ang isang gamot hindi isang gamot. Hindi niya sinasabi na totally na gamot siya or totally nakakagaling siya ng isang sakit. Diba? Yun yung mga tinatawag nating unrecognized. For example, pauliniment. Ayan. Ibig sabihin, hindi, yun yung mga type ng drugs na ginagamit lang natin parang extra as vitamins or parang pain reliever, ganyan. Pero hindi niya directly...
Ma'am, yung Red Bull. Hindi ba naging type of drugs ng Red Bull?
Alcohol. Alcohol lang.
Lang po siya kay ma'am. Thank you.
Okay. So, ang unrecognized, ito yung mga sinasabi nilang vitamins, ganyan, or any type na parang commercially product, yun nga, Lola Remedios or so what, na kanwari kapag daw iinom ka nito, hindi ka na magkakaroon ng rayuma, hindi ka na magkakaroon ng ganito. Pero lahat yon hindi niya sinasabi na totally or effective siya sa'yo. Kasi hindi naman siya yung direct na gamot. Intindihan po ba? Sabi niya, these are substances that are generally regulated by law. Still regulated by law yan kasi hindi naman yan pwedeng gawing commercial unless nakita nila na meron siyang side effects na iba. Nakuha? Again, those are unrecognized drugs. And then we have illicit drugs. This type of drugs naman are, ito yung mga pinagbabawal ng batas or illegal drugs. Okay, these are drugs who say purchase or use in generally prohibited by law, criminal penalties usually apply to violators of this law. So, yung mga drugs or yung mga illegal drugs na papabilang sila sa tinatawag nating illicit drugs. Next, we have also tobacco. Okay? Tobacco is not generally considered a drug, thus can be classed as an unrecognized drugs. Tobacco, however, holds such a distinct position in terms of usage patterns, economic importance, and health consequences that it merits the category by itself. Next naman, yung tobacco, ito ng mga cigarettes. Okay? And then we have alcohol. Yan. It seems to merit its own category. Okay? Although it too could be included in that unrecognized drugs. Okay, again, tobacco and alcohol, pwede silang parang i-subtype sa unrecognized. Okay po? So, alcohol in forms such as beers, wines, and distilled liquors is one of the most widely used drugs in the world. Okay? Kino-considered pa rin drug ang alcohol kasi yung content niya, yung nakaka-effect niya sa inyo. So, it is regarded by many experts as the most commonly abused drug. Bakit po? Kasi ang alcohol, wala namang batas na sabi na bawal kang uminom ng alak, di ba? Meron ba? Sa Pinas. Sabi bang, meron bang batas na sabing bawal kang uminom ng alak? Kapag siguro magdadrive ka, oo. Pero kung kanwari, iinom ka lang, hindi siya, di ba?
Pag underage, ma'am.
Gamot pa nga siya, ma'am, sa COVID eh.
Yan. O kaya nga siya nagiging unrecognized. Naging siyang gamot sa COVID. Ngayon ko lang narinig yon. Kaya yan. Kaya sabi niya, it is most commonly abused drugs kasi most of them, okay, yung, sa mga countries, wala namang directly batas na nagsasabi na bawal uminom ng alak. Diba? Kasi kung bawal uminom ng alak sa isa Pilipinas, therefore, wala na tayong Sun Legal Corporation or whatsoever. Diba? So, these are the 7 categories of drugs. We have herbal, over-the-counter, prescription, unrecognized, illicit, tobacco, and alcohol. Next, classification of drugs according to origin. Ano to? Is either, pinag-aralan na natin to nung first, nung mga sa ating course unit 2. Natural and synthetic. Diba? Kapag natural, ito yung walang halong chemical, ito lang yung parang yung mga herbs. Kinuha nyo sa bakuran nyo, kinuha nyo sa mga halaman. Therefore, that is unnatural. Paano siya nagiging synthetic? Kapag ang isang gamot, okay, pinadaan na sa mga laboratories, tapos naging ng powder yan, naging ng capsule, naging ng tablet, therefore, ang tawag na sa kanya ay synthetic. Always remember, if the drugs ay nagdaan sa mga chemically factored laboratories, therefore, they are called as synthetic. Again, we have 2 drugs according to origin, natural and synthetic. Next. Ito naman. How about to legal classification? Okay, classification of drugs according to legal classification. Okay, we have number 1, RA 9165 or yung sa ating yung mga drugs na napapabilong sa ating Comprehensive Dangerous Drug Act of 2002. Meron tayong prohibited and regulated. Kapag sinabi nating prohibited, okay? Pag sinabi nating prohibited, these are not legally sold. Okay, pag ba sinabing prohibited, bawal bilhin? Tatanungin ko kayo. Pag ba sinabi nating prohibited, bawal bilhin? Bawal bilhin unless
Bawal siya, ma'am, bilhin kung wala siyang authorization. Pero kung may authorization ka, ma'am, makakabili po kayo, ma'am.
Okay, that is what we call prohibited drugs. Kasi, kung kanwari, di ba yung mga artista or yung ibang doctors kasi, pinaprescribe nila ang pag-use ng heroin, marijuana, cocaine, opium. Kasi yung ibang effects kasi niyan, pwede siya dun sa mga mentally ill or pwede yun sa mga delirium or yung mga hindi nila makontrol. So, yung mga yan, okay, ginagamit din nila. So, usually yung mga prohibited drugs na yan, ang doktor lang po ang pwedeng mag-prescribe niyan or makagamit. And then we also have regulated. Ito naman, sold with prescription. Itong regulated drugs, okay, ito yung makakabili ka sa over-the-counter na pharmacy, pero with reseta or prescription coming from the, coming from the doctor or the physician. Again, to legal classification, as according to RA 9165, we have no illicit drugs or yung mga pinagbabawal na gamot. We also have the prohibited na mabibili lang siya unless there is a authorization from the competent authority and regulated, mabibili lang siya with prescription. Okay po? Next naman, okay? Classification of drugs according to international classification. Ito, we have narcotic substances, we have psychotropic substances, and the last one, we have designer drugs. Ano po yung narcotic substances? These are any drug that produces sleep, okay, or stupor, or mga pain reliever, okay, depress the central nervous system to produce a marked reduction in sensitivity to pain, create drowsiness, reduce physical activity. So, madalas, ang narcotic substances, ito yung mga sleeping pills, sabi nga nila. So, a drug with therapeutic doses diminishes awareness of sensory impulses, especially pain or by the brain. In large doses, it causes stupor, coma, and convulsions. Kapag naman napasobra ang isang tao na nag-take ng narcotic substances, therefore, pwede siyang maging yung makomatose. Ayan. Or sometimes, it can cause convulsions. Next naman, psychotropic substances. These are any substance, natural, it can be natural or synthetic, or any natural material that have high potential for dependence and abuse. So, these drugs are highly addictive, but despite the risk, they remain medical use because no satisfactory non-addictive alternative medication is available. Yung mga psychotropic substances, ito ginagamit din siya for medicinal use. But, meron silang addictive, nakaka-addict na tawag dito, effect. So, anong example niyan? Marijuana, cocaine, amphetamines, morphine, and some barbiturates. So, ginagamit ito in medicinal purposes, but nakikita nila na meron siyang potential for dependence and abuse kasi nga meron siyang addictive form. And then, the last one, designer drugs, okay? This substance chemically related to but slightly different from controlled substances. Designed by clandestine chemists with that producer of the high or euphoria. Ano ibig sabihin ng euphoria? Or euphoric? Masaya, excessive happiness. So, yung mga designer drugs na to, ang effect niya is yan, pampahay, pampasaya. Okay po? So, euphoria of parent drugs and avoid the penalties that would be levied against those illegally trafficking the controlled substances. So, these are the designer drugs. LSD, MDMA, diba, ecstasy. Yan. So, those are the classification of drugs according to international classification. Next. Ito. How do drugs work? Or paano nakaka-apekto ang drugs? So, ito. Most of the drugs act within a cell. So, rather than on a surface of a cell or in the extracellular fluids of the body, similar to normal body chemicals, a drug enters a cell and participates in a few steps of the normal sequence of a cellular process. So, thus, drugs may later interfere with or replace chemicals of normal cellular life, hopefully for the betterment of the person. The actual action of particular drug depends on its chemical makeup. So, ang nangyari kasi dyan, di ba may mga glands tayo or so whatever na nag-produce ng ating mga, kanwari, dopamine, ganyan. So, once na nag-enter kasi yung drug sa ating body, okay, yung mga normally na ine-excrete or ine-excrete ng mga glands natin, papalitan yan. Okay, mapapalitan yan. So, when two drugs are taken together or within a few hours of each other, they may interact with unexpected results. So, this is one of the reasons a physician should always know the names of all drugs one is using. So, a dose of a drug, again, a dose of a drug is the amount of taken at one time. Ano po yun? Yung dosage. Ito yung dami or quantity na kailangan mong i-take sa gantong oras. So, the doses taken become an extremely important part of drug abuse. Bakit po? Bakit kailangan ng dosage kapag umiinom ng gamot? Kasi po, okay, taking of drugs into a maximum amount or maximum dosage, it would cause harmful effects or detrimental effects into a person, which would cause into its abuses, into its dependability, and then into addiction. Kasi abuse muna eh. Tapos magiging dependent ka. Tapos magiging addict ka na. Tapos magiging dependent ka na. So, ganun yan. So, next week yata, I mean sa course unit 9, madidiscuss natin kung paano na-addict yung isang tao. So, the doses taken become extremely important part of drug abuse. So, the amount of drug in a dose can be described as, ano ba yung mga different dosage natin? Ayan. So, these are the physiology of drugs. These are the different dosage. Number 1, we have minimal dose. Pag sinabi natin minimal dose, this is the smallest amount of drug that will produce a therapeutic effect. Pag sinabi natin minimal dose, diba? For example, you can take this drug 3 times a day or 2 times a day. So, yung 2 times a day na yun yung pinaka-minimal dose mo. Therefore, meron pa rin siyang therapeutic effect or parang pinapagaling ka lang niya. Diba? Next, maximal dose. Ibig sabihin, this is the largest amount that drug will produce a therapeutic effect without any accompanying symptoms of toxicity. So, kapag sinabi ni doktor, sige, pwede mong i-take to maghapon, pwedeng 2 times in a day or 3 times in a day. Ibig sabihin, yung 2 times a day mo, yun yung pinaka-minimal dose mo. Yung 3 times a day mo, yun yung pinaka-maximum dose mo na pwede mong i-take yung isang gamot. Kasi kapag nag-produce ka pa ng another, or kanwari, ginawa mong 4 sa isang beses, therefore, hindi na siya sakto dun sa tinatawag nating maximal dose. Okay? Ito na, siguro pwede ka nang pumasok sa tinatawag nating toxic dose. Ano yung toxic dose? The amount of drug that produces untoward effects or symptoms of poisoning. Ang toxic dose, eto na yung nasusuka ka, diba? Nahihilo ka, that is a toxic dose. Ibig sabihin, parang hindi na kaya ng katawan mo yung dosage. And then we also have the abusive dose. Ito naman, the amount needed to produce the side effects and action desired by an individual who improperly uses it. Ito naman, kaya siya nagiging abusive dose kasi hinahanap mo yung after effects ng drugs sa'yo. Okay? And then the last one. Okay? The last one dosage is the lethal dose. This is the amount of drug that will cause death. Ito na yung kapag napasobra talaga yung pag-inom mo ng kape or talagang sinasadya mong uminom ng napakadaming gamot sa isang araw, nakakamatay na. I'll just give you an example paano itong minimal dose, maximal dose, toxic dose, abusive dose. Sinabi ng doktor mo, Doc, nagpa-check up ka. Doc, lagi kasi akong matamlay. Lagi akong walang energy. Ano po ba yung pwede niyong i-prescribe sa akin? Ang sinabi sa kanya ni doktor, sige, inom ka ng kape. Okay? Inom ka ng kape. Sabihin natin, pwede kang uminom ng kape ng 2 beses sa isang araw at pinaka-maximum na ang 3 beses sa isang araw. Kapag ang ginawa mo, uminom ka ng 2 beses ng kape sa isang araw, that is minimal dose. Okay? After that, okay, pag naman ang ginawa mo is uminom ka ng 3 beses ng kape sa isang araw, that is a maximal dose. Paano nagiging toxic dose? For example, kasi ang nangyayari kasi sa atin, tumataas yung tinatawag nating tolerance. Do you know what is tolerance? That is your ability to parang accept or kung paano mo ma-value or ma-measure kung gaano mo kakaya yung isang gamot. So, yun tolerance. So, for example, nasanay ka na, sabi natin 1 week, nung first week gumagawa ka, ang iniinom mo lang 2 cups of coffee a day. And then next week, try mo na yung maximal dose na 3 cups coffee in a day. And then, yung mapupunta ka na sa toxic dose. Bakit? Kasi nakita mo, parang kulang. Mag-i-start ka na kasi, once na na-immune kasi yung sarili mo. Okay? Ganito ang process paano nagiging addict sa kape or bakit nagiging addict sa mga gamot yung iba sa drugs. Once na naging immune na, syempre na-immune ka sa 3 cups of coffee. Hanapin mo yung after effects niyan. Diba? Kapag napansin mo na bakit nakatatlo na akong kape pero hindi ko pa rin makuha, parang inaantok pa din ako, then magiging toxic dose na yan. Ano gagawin mo? Dadagdagan mo. Gagawin mo 4 niyan. Ngayon, sa pag-take mo ng 4 na yan, okay, it's either meron siyang effect sa'yo na nahihilo ka, nasusuka ka. Kasi nga, bago pa lang sa'yo yan. Diba? Parang, nag-exceed ka na doon sa maximum dose mo. So, naging toxic dose na siya. Ito na yung nahihilo, nasusuka. Ito yung pinapakita na parang na-poison ka. After that, okay, after mo na-experience yung may panghilo, pagsusuka, nakita mo maganda yung effect sa'yo, lalo kang naging alive, anong gagawin mo? Dadagdagan mo pa yan. At doon papasok na yung tinatawag nating abusive dose. Bakit? Kasi hinahanap mo yung desired effect ng isang gamot. So, nakita mo, Naka-4 akong kape, yun ang naging epekto niya, naging alive ako for a day. So, natatapos ko yung trabaho ko. Paano magiging abusive nun? Dahil gusto mong hanap-hanapin yung effect sa'yo ng kape, na ginigising ka ng ganyan. The more na tumatagal, nagiging tolerate or natotolerate ng katawan mo yung ganong klase ng kape, hahanap-hanapin mo yon hanggang sa para lang malanasan mo ulit yung ganong epekto, ha? Dagdagan mo yung pag-intake mo ng drugs. Kasi nga, hinahanap mo yung epekto. Intindihan? So, yun ang part na nag-a-abuse mo na. Kasi unti-unti nagiging dependent na yung katawan mo dun sa drugs na yun or yung sa kape. Diba? After nun, okay, without knowing, diba, hindi mo nakikita yung progress or nakikita yung effect nito sa body mo, maaaring pinapagising ka lagi ng kape. Pero paano siya nagiging lethal dose? Kapag nasobrahan ka na. Baka sobra na yung pag-inom mo ng kape, naging ng 10 times a day. So, yung lethal dose na yan, it will cause a death. Ibig sabihin, talagang tinodo mo na. It is just an example, ha? Hindi ko sinabing ganun talaga ang magpapatayin ka ng kape, ha? It is just an example. Yes, Mark Anthony Macan.
Tapos din po ba dito yung lethal injection? Kasi cause of death.
Lethal injection? Pwede kapag, ano yon, syempre, a form of penalty yon. Talagang ano yon. Poison naman kasi talaga ang tawag doon, ang binibigay. Ang pinapaliwanag ko dito kung paano tumataas yung dosage ng isang gamot or yung paano nagiging tumataas yung tolerance natin sa gamot. Okay ba tayo doon, Mark Anthony Macan? Basta kapag ang gamot is, ang epekto niya is parang papatayin na niya ang isang tao, sobrang lakas niya, sa sobrang tindi ng quantity or quality niya, that is a lethal dose. So, ang in-explain ko sa inyo kanina kung paano tumataas yung dosage natin. So, parang ako, bakit ko sinabi yung kape? Kasi dati, ayoko talaga ng kape. Ha? Kasi, I do not drink coffee kasi ang epekto niya sa akin nung una, kasi alam nyo, ang kape, it is a type of a drug, caffeine. Pag-aaralan din natin yan. Kasama siya sa stimulants. Ang epekto na sa akin kasi ng kape, nung umiinom ako ng kape, sumasakit yung tiyan ko. Buong araw sira ang tiyan ko, tapos hindi niya ako papatulugin ng isang buong araw. So, dahil hindi ako sanay, dahil puro gatas ang pinapainom sa akin magsimula ng bata ko, gatas, Milo lang ganyan. Tapos ngayon, okay, habang tumatanda ako, there is a one time, magbo-board exam na kami. So, magbo-board exam na kami, kailangan, syempre active lagi. Araw-araw nag-aaral. So, dahil nasa bahay lang ako na, tas 2 days Manila, 5 days bahay, 2 days Manila. Ang nangyari sa akin nun, parang nawawalan ako ng energy pagka-uwi ko from Manila. And then, hindi ako nakakapagbasa. So, I need to wake up myself. Kasi, sayang yung time. Anong ginawa ko? Try mo kaya, sabi nila. Merong, alam niyo yung, hindi ko alam ano, Great Taste yata yon, yung may chocolate coffee. Coffee late na chocky.
Great Taste Choco.
Oh, Great Taste Choco. So, para siyang chocolate siya, and then may coffee, di ba? So, trinay ko lang siya. So, doon nakita ko, okay. So, pwede, hindi na masyadong, hindi na sumasakit yung tiyan ko. So, sabi ko, kung hahaluan ko pala ng chocolate ang kape, hindi niya ako masyadong yung, tawag doon, yung tolerance ko, hindi siya ganun hindi niya ako papasukahin, hindi niya sisirain yung tiyan ko, whatsoever. Papatulugin niya pa din ako. And then, I tried. And then one day I tried, so unti-unti, nasasanay ako dun sa coffee, di ba? Nagiging immune na yung katawan ko, or nagiging okay na yung body ko dun sa mismong coffee. Hanggang sa na-try ko na yung uminom talaga ako ng kape ng Great Taste lang, na without chocolate. So, yon. So, na-try ko ng minimal and maximal dose. So, dati, umiinom ako ng coffee na yon, siguro yung, meron akong mug na ganito kalaki. Alam mo yung mga tumbler? Tapos, isang ganun lang siya, pero napakadami niyang tubig. Kasi natatakot pa ako nung that day yung baka yung sobra yung epekto niya. So, yun. Di okay pa. So, nakukuha ko yung tulog ko pa din ng siguro meron pa rin ako 5 hours na tulog sa isang araw. Ganun pa rin siya. Nakakatulog pa ako. Hanggang sa nung habang tumatagal na ganun ang ginagawa ko, every time na kailangan kong gamitin yung utak ko, I only use cafe or I only drink cafe when I need to use my brain or yung kailangan ko talagang mag-focus. So, ang ginawa ko nun, nakita ko, bakit parang one day, dahil siguro sunod-sunod na araw nun, parang wala nang epekto sa akin yung kape. Bakit? Kasi parang inaraw-araw ko siya. Sabi ko, sabi ko ganyan, nakakatulog na ako ng 8 hours, nakakatulog na ako ng ganito. So, ang ginawa ko, tinaasan ko yung dosage ko. Diba? Anong mangyari nun? Kasi wala nang epekto sa akin yung ganito kalaking kape. Ibig sabihin nun, kailangan kong bawasan yung tubig, kailangan kong dagdagan ng kape. Bakit? Hinahanap ko kasi yung desired effect. Yun ang nangyayari kung bakit na-abuse natin or nagiging drug addict ang isang tao. Kasi hinahanap natin yung desired effect. Kasi ako, hinahanap ko yung, bakit ganun? Nakakatulog na ako ng 10 hours, hindi na yung 5 hours na lang yung tulog ko. Diba? Kasi, nasanay na yung katawan ko na ganito. So, kailangan para makuha ko ulit yung parang 5 hours na tulog lang, kailangan bawasan ko yung tubig, dagdagan ko yung kape. So, ganun lang siya. So, ang ini-explain ko sa inyo is paano na-addict ang isang tao, okay, sa paggamit ng gamot or whatsoever. Naiintindihan na ba niyan? Kasi it has something to do with the dosage or yung quantity or quality ng iniinom nyo. Okay po ba tayo doon? Do you understand now? Hello?
Yes, ma'am.
Yes, ma'am.
Yes po.
Okay. We have the medical uses of drugs. Okay? Medical uses of drugs. Analgesics. Ano yung mga analgesic na to? Ito yung mga paracetamol. Usually, okay, it always relieves pain. Yung mga analgesic, example niyan, biogesic. Okay? Ingat. Yan. We also have antibiotics. Ito naman that combat infectious diseases. Ito yung amoxicillin, di ba? For example, nasugat ka, ay saliming amoxicillin na data para hindi siya ma-infection or so what. And then we have antipyretics. Ito namang type of drug na to, those that can lower body temperature or fever due to infection. Ito yung mga tempra, alam mo yung patch fever. So, ang ginagawa ng mga gamot na to, pinapababa niya yung init ng katawan. And then we also have antihistamines. These are the group of drugs that controls allergic reactions. So, for example, allergic ka sa hipon, allergic ka sa alikabok, ayan yung mga claritin, diba? Pwede rin yung cetirizine, ayan. So, ang tawag dun sa mga gamot na yan ay antihistamines. And then we also have contraceptives for birth control. Usually yung mga mag-asawa, tapos gumagamit sila ng calendar method, diba? Tapos, ewan ko, pag daw umuwi sila nito, ito yung, tinanungan ko kasi yung kaibigan ko sabi niya, Yasmin daw yung iniinom nila. So, kapag uminom sila ng ganyan, parang sure ball yata na hindi siya mabubuntis. So, yan, contraceptives for birth control. And then we also have decongestant. Okay, ito naman yung mga decolchen. Those that relieve congestion from nasal passages. Ito yung masakit yung ulo, ganyan, or parang sinisipon. Yan, inom sila ng decolchen. So, these are the groups of medical uses of drugs. And then, we also have expectorants. Okay? Those that can ease the expulsion of the mucus and phlegm from the lungs and the throat. And for example, meron kang sipon, plema. Okay? So, ito yung mga phlegmex. Diba? Or yung mga lagundi. Ayan. Robustin. Ayan. Ang tawag doon ay expectorants. And then, we have laxatives. Ang laxatives naman, those that stimulate defecation and encourage bowel movement. Pag sinabing defecation, ito yung pagtatae. Para pataiin ka niya. So, this laxative. Ito yung mga Dulcolax. Okay, sometimes it is in a form of tea. Diba? Madalas sa tea yan. Parang lalagay nila sa tsaa. Pag uminom ka ng tsaa, diba, yung mga nagpapapayat, umiinom sila lagi ng tsaa kasi pinapapupo sila or parang pinapagdumi. And then, we also have sedatives and tranquilizers. Ang example niyan, yung Valium. Diba? Those that can calm, quiet the nerves, and relieve anxiety without causing depression and clouding the mind. Ang sedative and tranquilizer para lang siyang sleeping pills or whatsoever, para lang kumalma ka, pampakalma, sabi nga ng doktor. And then, syempre, the last one, vitamins. Ayan. These are the substances that are necessary for normal growth and development and proper functioning of the body. So, vitamins, for example, diba? Vitamin C, Centrum. Ayan. So, those are the different groups of drugs in its medical uses. Next. Ayan. Dangerous effects of drugs. Okay, pwede kayong ma-overdose, pwedeng allergy, idiosyncrasy, poisonous property, and side effects. Overdose. Ayan, di ba? Dangerous effects of drugs, number 1 dyan ang overdose. When too much drugs are taken into physiological system of the body, there may be an overextension in its effects. Kaya yung mga parang nasusuka ka na, parang minsan nakakamatay na siya. Those are the overdose. And then we have allergy. Merong mga allergy sa gamot. Di ba? Some drugs causes the release of histamine, giving rise to allergic symptoms such as dermatitis, swelling, suffocation, and death. For example, sa alak. Di ba, ino-consider natin ang alcohol as a drug. So therefore, di ba, may mga tao din na allergic sila sa drug. Kapag uminom sila ng drugs is minsan may lumalabas-labas na spot sa kanila, minsan namamaga, or minsan nahihirapan silang huminga. That is a form of allergy. So may mga gamot na kapag tinik natin, allergic kayo doon sa gamot na yon. And then you also have idiosyncrasy. Itong idiosyncrasy na to, hindi nila ma-explain. Okay? It refers to an individual reaction to drug for unexplained reasons. For example, uminom ka ng drugs, tapos meron siyang side effects na hindi nila mapaliwanag. Ang tawag doon ay idiosyncrasy. Next naman, we have also the poisonous property. So, drugs are chemicals and some of them have the property of being poison. So, hindi naman po, sabi nga natin, all medicines are drugs, but not all drugs are medicine. Next, we have, lastly, the side effects. Siyempre, sure na yan. Merong side effects talagang drugs. Once you take a drug, sigurado merong side effect yan. So, some drugs are not receptors for one organ, but receptors of other organs as well. For example, alam niyo yung mga sa diabetes, diba? Umiinom sila ng gamot sa diabetes para makontrol ang sugar nila. Pero anong ang side effects niyan? Diba natatamaan yung bato nila? Diba? So, meron kasing mga gamot na pagagalingin niya yung isang sakit, pero meron siyang side effects dun sa iba. So, the result is one organ may constitute a side effect which are most of the time unwanted. So, madalas nakikita ko yan sa mga diabetes eh. Kasi, ginagamot nga yung sugar nila, pero ang nangyayari, naapektuhan yung bato nila. 'Di ba? Kasi madami ng intake ng gamot. So, those are the different dangerous effects of drugs. Overdose, allergy, idiosyncrasy, poisonous property, and side effects. Okay. Difference of drugs, we have pharmaceutical drugs and recreational drugs. Pag sinabi nating pharmaceutical drugs, these are the uses of drugs wherein to treat or to cure a disease. Or to prevent a disease. Is either to cure, to treat, or prevent a disease. That is a pharmaceutical drugs. Paano naman yung mga recreational drugs? Ito na yung mga chemical substances na ginagamit mo for just enjoyment. Wala ka namang ginagamot na sakit. For just leisure purposes lang, for entertainment. So, rather than for medical reasons. Example of this, alcohol, tobacco, and caffeine. So, recreational drugs ang tawag sa mga yan. So, di ba, wala naman siyang ginagamot sa inyo, pero ginagamit mo yan for enjoyment, leisure purposes, or entertainment. So, pero kapag ang gamit ng gamot is para pagalingin ka, i-prevent ang sakit, or parang bigyan ng proper treatment ang sakit, that is pharmaceutical drugs. Next, last one, ayan na. So, we're down to the last topic, the pharmacological classification of drugs. So, we have 4 pharmacological classification of drugs. We have hallucinogens, stimulants, depressants, and narcotics. Anong pinagkaiba ng mga hallucinogens, stimulants, depressants, and narcotics? Again, kapag sinabi nating pharmacological classification of drugs, these are the group of drugs according to their effects. Okay? Kapag sinabi nating hallucinogens, okay, these are drugs that capable of provoking sensation, thinking, self-awareness, and emotions. Parang nag-hallucinate ka. Ibig sabihin, ito yung mga drugs, kapag tinik mo, ang effect niya sa'yo is hallucination. So, alteration of time, space, perceptions, illusions, hallucination, and delusions. It may be minimal or overwhelming depending on the dose. So, the results are variable, a good trip or a bad trip. Okay? So, it may occur in the same person on different occasions. LSD man yan, marijuana, mescaline are some of the most popular hallucinogens. So, don't you worry, these 4 types of drugs, okay, pag-aaralan pa natin yan mismo further on next week. Kasi we have different group of drugs na titingnan natin ano yung mga hallucinogenic drugs, ano yung mga tinatawag natin stimulant drugs, depressants, or even the narcotics. So, just an example of hallucinogens, ito yung mga marijuana, mescaline, any type of drug na kapag ang effect niya sa inyo is parang hinahalusinate niya kayo, katulad niyan. Yan, ganyan yung mga nakikita nyo, parang gumagalawang mga bagay. Therefore, ang na-take mo na drug is a type of hallucinogenic drugs. Next. Eto, stimulants. Kaya nga araw niya pataas. Pag sinabi natin stimulants, these are the group of drugs wherein it increase your alertness, reduce hunger, and provide a feeling of well-being. So, kasama dyan ang kape. Diba? Cocaine and amphetamines are the most common stimulants. Ang mga stimulants drugs, okay, katulad dyan, kape, cocaine, ayan. Kapag inunin mo yan, okay, ang nangyayari sa inyo, nagiging gising ka lagi. Hindi mo nararamdaman ang gutom, hindi mo nararamdaman ang pagod. So, uppers yan, kaya nga yung araw niya pataas. Kasi, these are the group of drugs na kapag ininom mo yan, hindi mo pa mararamdaman ng pagod or whatsoever. Okay? Next, meron naman tayo ng depressants. Kabaligtaran siya ng stimulants. Kung si stimulants ang ginagawa niya sa'yo, it increase your alertness, it reduce your hunger, hindi mo nararamdaman ng pagod. Kapag kay depressant naman, ito yung dinidecrease niya or dinedepress niya yung body functions mo. Ito na yung pinapatulog ka niya, pinapahina ka niya, or whatsoever. So, this group includes sedatives, ayan, hypnotics, and tranquilizers. So, those are what we call the depressants. Okay. And the last one of the last group of pharmacological classification of drugs is narcotics. Sometimes narcotics, nabibilang siya sa depressants. Sometimes po. Pero, okay, ang general kasing effect ng isang narcotic drugs, these are drugs which produce insensitivity, stupor, okay, parang pinagawa siyang malungkot, dullness, ayan, mind with delusions, opium, heroin, codeine, and morphine are some of the most popular narcotics. Or lahat ng gamot na kapag ang binibigay ng cause niya sa'yo is just for a painkiller or for pain reliever, therefore, ang tawag po sa drugs ng mga yan is narcotics. Okay, again, we have 4 pharmacological classification of drugs. We have hallucinogens, stimulants, depressants, and narcotics. So, napakadali lang yan. So, anyway, next meeting, we will go further to those 4 types. Bibigay natin yung mga different examples ng mga hallucinogens, stimulants, depressants, and narcotics. And then, dun natin masasabay din yung mga different types of illegal drugs. Dito nyo na makikilala sina marijuana, cocaine. Dapat papagawa ko sana yon as a report. Pero naisip ko, baka tumagal na naman katulad nung dati. So, ako na lang. Ipaprovide ko na lang lahat ng information na kailangan nyo. But, be sure, okay? Gantong gawin natin next week. Kasi maraming videos yon. Gusto ko kasing malaman nyo, hindi para gayahin nyo. But, I just want you to know on how to make the drugs. For example, may mga videos kasi kung paano gumawa ng cocaine, shabu, or whatsoever. So, next week kasi pag-aaralan natin kung paano or ano yung mga characteristics ng drugs na yan. Since we already know the different groups of drugs according to their pharmacological effects. Diba? So, next meeting, make sure na kapag sinabi kong panoorin nyo tong video na to, panoorin nyo. Para lang maging aware kayo and magdalawang isip kayo if i-take nyo pa yung drugs na yon. Kasi makikita nyo doon talaga kapag ginawa ang cocaine, gawa pala siya sa rugby, gawa pala siya sa insecticide or whatsoever. Minsan mandidiri ka na lang, ganyan. So, kaya, again, so, explain na lang natin yan further on or sa ating next meeting. So, do you have any questions? Do you have any questions? If you don't have any question, then I will just stop this recording.